Hey everyone, welcome back to another video. In today's video, I'm going to kickstart a new series, Labor and Delivery series. So it's going to talk about how our experience was with our labor, and since my wife is a labor and delivery nurse, I thought it would be cool to share her experiences now that she's given birth and that she's helped so many people, so many patients give birth, and kind of speak to how she does the coaching, but now that she's also been in labor, how she felt and how that changed her mind about labor. So the first video that we're going to create is talking about after labor and her thoughts on it overall. So as many of you know, if you're about to, if you have a wife that's giving birth or anything like that, you need to have a birthing plan. And that plan is a conversation you have with your spouse, and essentially it goes over what you expect to happen during birth. That's our coffee machine. Yeah, so our birth plan was to have Nicole have a natural delivery with no medication and no analgesia at all. That was her goal, and it's just something she wanted. It wasn't something that, I talked about it in our previous video where analgesia is a bad thing, but there are certain complications to an epidural, and being a labor and delivery nurse, she has found some anecdotal evidence that has, and also some evidence-based actually, that shows, epidurals, for instance, cause sort of complications leading to higher risk for C-sections and that sort of thing. And so she wanted to reduce that. So in this video though, we're going to particularly focus on what she felt after she's given birth and any advice and her opinion on the matter. So I guess firstly, how do you think the birthing process went, and what are your overall thoughts?
It was, I think I expected that it was going to hurt, but I did not know what type of pain to expect. And I know I have asked patients 100,000 times, like, what did it feel like try and describe it, and every time they just say, I can't. And I was always like, okay, I wish someone could have described it because that would have helped prepare me, but I would have the same answer. I can't describe it. It was not comparable, I'm sure, to anything else I'll ever go through, and it's so specific to this, and it's so many things going on that you really just kind of leave your body. Like, that's the way I keep describing it. I don't remember a lot of it. I felt like I couldn't see at times. I felt like I couldn't hear at times. It was an overwhelming experience, but so raw. Like, you're just reduced down to like the most animalistic part of yourself, and you can't even try to control the vast majority of it. It's not a mind game anymore. It's just, you just have to let your body take over. That being said though, it went so well. It could not have gone better in terms of what we hoped for. I had my hopes and my preferences, like Seth talks about a birth plan, but you aren't always sure that it's going to go that way. I think most of my brain thought it probably wouldn't go that perfectly, but it did in the end, so I'm very happy. Thinking I was going to die, but thinking I was going to die went great.
Yeah, I mean, we were overall happy with our provider. Like we mentioned in the previous video, we did have a midwife, and our midwife group was so excellent in providing care and support and reassuring me that everything is going well throughout the whole process. So Nicole started really feeling these hardcore contractions every 5 minutes at around 12 p.m. And so it got, just around noon, it got progressively worse and worse. The contractions caused her pain in her, obviously, pelvic area, but then it radiated to her lower back, and it was to the point where she couldn't breathe properly and walk properly. So she needed a second to bend over because the pain was so severe. And so that's how we knew that things were progressing really intensely. And that's when we reached out to our midwife, probably around, around 4 p.m. that day. We were like, okay, these pains are getting so severe. We just want to, have the midwife come in and do a vaginal exam. So So sorry about that. Jasper was crying, her baby. But so to bring it back, at 4 p.m. that day, what did you feel that you knew you wanted to contact the midwife or go to the, in many people's cases, go to the hospital? What made it feel different, and at what point did you know that you wanted to do that?
Maybe around like 2 p.m. things started to feel a lot worse to me. The frequency was still about the same, like every, I don't know, maybe every 5 to 10 minutes, somewhere in there, but definitely the intensity was getting worse, and it kept getting worse, and my plan was around 3:30 to call the midwives, and around 3:30 I was still doing okay, and then around 4 I was having a contraction that was really bad, and we had learned some techniques in prenatal class for doing acupressure and just counter pressure, as they call it, one of them being what's called the hip squeeze, where you just squeeze outside of the hips just to help kind of tilt the pelvis a little bit and take some pressure off. And he was doing that, and all of a sudden I had this really bizarre sensation, like I thought maybe my water was about to break because it seemed like a popping sensation. But my water didn't break, and I just wonder if maybe baby just slammed down into my pelvis really quickly at that point, because immediately after that contraction things felt so much worse. So I called her right like after that contraction. It was like, I need you to come right now.
So the key there was the intensity was so severe, and it got upped to something where you've never felt before, and that's when you decided, okay, I'm gonna call the provider. But it was also the frequency that was constantly there throughout the day, but then the intensity is what threw you over the edge, and you're like, okay, I'm gonna call the provider now. Interesting.
And I was gonna say before as well, like, I think as a first-time mom, even though I deal with this with patients every day who call and say, like, should I come in now? Like, do I think it's a good time? And all the time we say to patients, like, if you're on the fence about it, it's not the right time. Like, you're not in labor if you're questioning if it's the right time or not. And that could not have been more true for myself, because it was like all afternoon I was thinking, should I call now? Okay, my plan is to call in half an hour. And it was like, okay, if you can make a plan to call in half an hour, like, you're still okay. But as soon as I had that sensation, there was no more like, okay, I can make a plan. It's like, you either know or you don't know. And I can't describe it in any other way other than to just go through it yourself. But I like, you will know when it's bad enough that things have changed.
Okay, well, and then so after 4, obviously the midwife came and did a vaginal exam and found that you were, I think you were 4 centimeters?
She said 4 to 5, yeah.
4 to 5 centimeters roughly. But apart from that, she also did a membrane sweep. So maybe you can talk a little bit about what a membrane sweep is, just roughly.
Membrane sweeps, they're used often like before labor starts to help kind of kick things off. But it's just basically where the provider will insert their fingers through your cervix and kind of separate the outside of the membranes from the inside of the uterine wall. And the idea is by doing that, you're causing a cascade of prostaglandins, which is irritating to the cervix and the uterus, hoping to start it contracting. But I was already like, I was already on the verge of being in like really crappy labor, and so when she was like, oh, I did a quick sweep, I was like, how dare you? And after that, it was, once again, it just like it got even worse after. Yeah,
and so it progressed further, and one of the things that they do on a vaginal exam is they check to make sure the baby's position is optimal for delivery. And of course, if they find any kind of feeling that it might be, it might be breech, or they might have any sort of doubts, they go ahead and get an ultrasound done. A bedside ultrasound was done in our case because our midwife was not sure if she felt head, if she felt foot, so she did a quick bedside just to confirm. And when we went to the hospital and she did that, and we found out that it was actually the baby's head, but the baby's arm is what we think. The baby's arm was right here, or the hand was right here, and so it kind of felt like maybe a foot. And so essentially we just did that just to make sure. Of course the midwife suggested we do that. So after that we came home and things just got more intense for Nicole. Would you say it got like it got really intense? And what did you feel? Did you feel, at 4 p.m. when I talked about that intensity that got up, was it just that intensity constantly, or was it even more intense?
At that point, I would say that the
contractions.
frequency is what changed. So after we came back from the hospital, which was just brief, and I walked there. Like, I walked there, I was still smiling in between contractions, like, things were still okay, I was still coping fine. The plan was that the midwife was gonna come back in about an hour, and she said, call me, you know, if things change before an hour. Well, I called her about 45 minutes later, because after I had walked home, I could not believe in that time period how much had changed. It was like, they were every 3 minutes. I could not, like, there was no way I could speak through them. Even the counter pressure that Sep was doing at that point was just becoming, like, so intense around my hips. It wasn't necessarily my back, it was like my flanks, and nothing was relieving that. Like, there was a shift once again in how I felt. So I would say, again, to someone wondering, like, how will I know that things are changing? You will so feel that things have changed. Yeah.
Awesome, great. And so, you know, it just got more intense, it got more frequent, and like we said in the beginning, we didn't want any analgesia or any of that nature. So I'm just gonna stop it right there. And in this video, I just want to give kind of an overview of how the labor went. In my next video series, or in my next videos, I'm gonna really talk about the labor, and I'm gonna talk about what we use to help Nicole get through it, and what I believe to be helpful, and what Nicole found was helpful after, you know, we successfully gave birth to our child. She told me what was helpful, and I want to share that knowledge with you guys so that maybe you can use it for your wife or anybody that you know that might be giving birth. Thank you so much for watching, and stay tuned for the next ones.